Hi everybody, I'm going to talk about cerebral palsy. Cerebral palsy is a diagnostic term used to describe a group of motor syndrome resulting from disorders of early brain development. Muscle strength is an essential factor of an individual to perform his or her daily activities. Muscle strength and power is an essential developmental task in a person's milestone. Cerebral palsy is a heterogeneous, persistent disorder of movement and posture. It is a chronic, non-progressive neurological condition caused by defects or leisure of immature brain. It affects the motor area of the brain's outer layer, the part of the brain that directs muscle movement. Even though cerebral palsy affects muscle movement, it is not caused by problems in the muscles and nerves. The early signs of cerebral palsy usually appear before a child reaches 3 years of age. At the end of this talk, you will gain an adequate knowledge about the definition, epidemiology, and history of cerebral palsy, know the various types of cerebral palsy, understand the causes and symptoms of cerebral palsy, and learn the management of cerebral palsy. Let me explain the definition of cerebral palsy. According to the Rehabilitation Council of India, cerebral palsy is a group of conditions that are characterized by chronic disorders of movement or postures. It is cortical in origin, manifests itself early in life, and is not the outcome of a progressive disease. Cerebral palsy describes a group of disorders of the development of movement and posture causing activity limitation that are attributed to non-progressive disturbances that occurred in the developing fetal or infant brain. The motor disorders of cerebral palsy are often accompanied by disturbances of sensation, cognition, communication, perception, behavior, and by seizure disorders. Cerebral palsy is a syndrome indicating a combination of visible characteristics such as motor disorder, medical conditions, sensory impairments, hearing disabilities, attention deficits, language and perceptual deficits, behavioral problems, and mental retardation. Prevalence of cerebral palsy is in the range of 1.5 to 2.5 per thousand live births. While exact figures are unavailable in India, it can be safely estimated that the cumulative figures for living population at any given point may be staggering. It is caused by abnormal development of part of the brain or by damage to parts of the brain that control movement. This damage can occur before, during, or shortly after birth. The majority of children have congenital cerebral palsy, although it may not be detected until a few months or years later. A small number of children have acquired cerebral palsy after birth. Some causes of acquired cerebral palsy include brain damage in the first few months or years of life, brain infections such as bacterial meningitis or viral encephalitis, problems with blood flow to the brain or head injury from a motor vehicle accident, a fall, or child abuse. In many cases, the cause of cerebral palsy is unknown. Possible causes include genetic abnormalities, congenital brain malformations, maternal infections or fevers, or fetal injury. Damage to the brain may cause its symptoms. Let me outline the possible brain damages which can cause cerebral palsy. First, damage to the white matter of the brain or periventricular leukomalacia. The white matter of the brain is responsible for transmitting signals inside the brain and to the rest of the body. A damage from periventricular leukomalacia looks like tiny holes in the white matter of an infant's brain. These gaps in brain tissue interfere with the normal transmission of signals. Second, abnormal development of the brain or cerebral dysgenesis. Any interruption of the normal process of brain growth during fetal development can cause brain malformations that interfere with the transmission of brain signals. Mutations in the genes that control brain development during this early period can keep the brain from developing normally. Infections, fevers, trauma, or other conditions that cause unhealthy conditions in the womb also put an unborn baby's nervous system at risk. 3. Bleeding in the brain or intracranial hemorrhage. Bleeding inside the brain from blocked or broken blood vessels is commonly caused by fetal stroke. Some babies suffer a stroke while still in the womb because of blood clots in the placenta that block blood flow in the brain. Other types of fetal stroke are caused by malformed or weak blood vessels in the brain or by blood clotting abnormalities. Maternal high blood pressure is a common medical disorder during pregnancy and is more common in babies with fetal stroke. Maternal infection, especially pelvic inflammatory disease, that also been shown to increase the risk of fetal stroke. Fourth, severe lack of oxygen in the brain. Asphyxia, a lack of oxygen in the brain caused by an interruption in breathing or poor oxygen supply, is common for a brief period of time in babies due to the stress of labor and delivery. If the supply of oxygen is cut off or reduced for lengthy periods, an infant can develop a type of brain damage which destroys tissue in the cerebral motor cortex and other areas of the brain. This kind of damage can also be caused by severe maternal low blood pressure, rupture of the uterus, detachment of the placenta, or problems involving the umbilical cord, or severe trauma to the head during labor and delivery. Let me now mention the symptoms which children with this cerebral palsy exhibit. Lack of muscle coordination when performing voluntary movements, stiff or tight muscles and exaggerated reflexes, weakness in one or more arm or leg, walking on the toes, a crouched gait or a scissored gait, variations in muscle tone either too stiff or too floppy, excessive drooling or difficulties in swallowing or speaking, shaking or random involuntary movements, delays in reaching motor skill milestones, and difficulty with the precise movements such as writing or buttoning a shirt. Spastic cerebral palsy is the most common type of the disorder. People have stiff muscles and awkward movements. Let me tell you about the forms of spastic cerebral palsy. Spastic hemiplegia or hemiparesis typically affects the arm and hand on one side of the body, but it can also include the leg. Children with spastic hemiplegia generally walk later and on tiptoe because of tight heel tendons. The arm and leg of the affected side are frequently shorter and thinner. Some children will develop an abnormal curvature of the spine. A child with spastic hemiplegia may also have seizures. Speech will be delayed and at best may be competent, but intelligence is usually normal. 2. Spastic diplegia or dysparesis involve muscle stiffness that is predominantly in the legs and less severely affects the arms and face, although the hands may be clumsy. Tendon reflexes in the legs are hyperactive. Toes point up when the bottom of the foot is stimulated. Tightness in certain leg muscles makes the legs move like the arms of a scissor. Children may require a walker or leg braces. Intelligence and language skills are usually normal. 3. Spastic quadriplegia is the most severe form of cerebral palsy and is often associated with moderate to severe intellectual disability. It is caused by widespread damage to the brain or significant brain malformation. Children will often have severe stiffness in their limbs but a floppy neck. They are rarely able to walk. Speaking and being understood are difficult. Seizures can be frequent and hard to control. The fourth one is dyskinetic cerebral palsy, which is characterized by slow and uncontrollable writhing or jerky movements of the hands, feet, arms, or legs. Hyperactivity in the muscles of the face and tongue makes some children grimace or drool. They find it difficult to sit straight or walk. Some children have problems of hearing, controlling their breathing, and coordinating the muscle movements required for speaking. Intelligence is rarely affected in these forms of cerebral palsy. 5. Ataxic cerebral palsy affects balance and depth perception. Children with ataxic cerebral palsy will often have poor coordination and walk unsteadily with a wide-based gait. They have difficulty with quick or precise movements such as writing or buttoning a shirt, or a hard time controlling voluntary movement such as reaching for a book. Mental impairment is more common among those with spastic quadriplegia than in those with other types of cerebral palsy. Children with moderate to severe cerebral palsy, especially those with spastic quadriparesis, often lag behind in growth and development. Speech and language disorders such as difficulty in forming words and speaking clearly are present in more than a third of persons with cerebral palsy. Poor speech impairs communication and is often interpreted as a sign of cognitive impairment, which can be very frustrating to children with cerebral palsy, especially the majority who have average to above average intelligence. Most children with cerebral palsy are diagnosed during the first 2 years of life, but if a child's symptoms are mild, it can be difficult for a doctor to make a reliable diagnosis before the age of 4 or 5. Doctors will order a series of tests to evaluate the child's motor skills. During regular visits, the doctor will monitor the child's development, growth, muscle tone, age-appropriate motor control, hearing and vision, posture, and coordination in order to rule out other disorders that could cause similar symptoms. Although symptoms may change over time, cerebral palsy is not progressive. If a child is continuously losing motor skills, the problem more likely is a coordination other than cerebral palsy, such as a genetic or muscle disease, metabolism disorder, or tumors in the nervous system. Lab tests can identify other conditions that may cause symptoms similar to those associated with cerebral palsy. Neuroimaging techniques that allow doctors to look into the brain can detect abnormalities that indicate a potentially treatable movement disorder. Let me briefly explain about the neuroimaging methods. Cranial ultrasound uses high-frequency sound waves to produce pictures of the brains of young babies. It is used for high-risk premature infants because it is the least intrusive of the imaging techniques, although it is not as successful as computer tomography or magnetic resonance imaging at capturing subtle changes in white matter, the type of brain tissue that is damaged in cerebral palsy. Computer tomography, known as CT, uses X-rays to create images that show the structure of the brain and the areas of damage. Magnetic resonance imaging, known as MRI, uses a computer, a magnetic field, and radio waves to create an anatomical picture of the brain's tissues and structures. MRI can show the location and type of damage and offers finer levels of details than CT. Another test, known as an electroencephalogram, uses a series of electrodes that are either taped or temporarily pasted to the skull to detect electrical activity in the brain. Changes in the normal electrical pattern may help to identify epilepsy. Some metabolic disorders can masquerade as cerebral palsy. Most of the childhood metabolic disorders have characteristic brain abnormalities or malformations that will show up on an MRI. Other types of disorders can also be mistaken for cerebral palsy or can cause specific types of cerebral palsy. For example, coagulation disorders, which prevent blood from clotting or lead to excessive clotting, can cause prenatal or perinatal strokes that damage the brain and produce symptoms characteristic of cerebral palsy, most commonly hemiparetic cerebral palsy. Referrals to specialists such as a child neurologist, developmental pediatrician, or otologist aid in a more accurate diagnosis and help doctors develop a specific treatment plan. Cerebral palsy cannot be cured, but treatment will often improve a child's capabilities. Many children go on to enjoy near normal adult lives if their disabilities are properly managed. In general, if the treatment begins earlier, children have better chance of overcoming developmental disabilities or learning new ways to accomplish the tasks that challenge them. There is no standard therapy that works for every individual with a cerebral palsy. Once the assessment is made and the type of cerebral palsy is determined, a team of healthcare professionals will work with a child and his or her parents to identify the specific impairments and needs and then develop an appropriate plan to tackle the core abilities that affect the child's quality of life. Nevertheless, there are some major therapies which are effective in the interventions with the children. Let me outline some of these therapies, such as physical therapy, occupational therapy, recreation therapy, speech and language therapy, and so on. Physical therapy usually begins in the first few years of life or soon after the diagnosis is made, and it is a cornerstone of intervention for cerebral palsy. Specific sets of exercises such as resistive, or strength training programs and activities can maintain or improve muscle strength, balance, and motor skills and prevent contractures. Special braces, also called orthotic devices, may be used to improve mobility and stretch spastic muscles. Occupational therapy focuses on optimizing upper body function, improving posture, and making the most of a child's mobility. Occupational therapist helps individuals address new ways to meet everyday activities such as dressing, going to school, and participating in day-to-day activities. Recreation therapy encourages participation in art and cultural programs, sports, and other events that help an individual expand physical and cognitive skills and abilities. Parents of children who participate in recreational therapies usually notice an improvement in their child's speech, self-esteem, and emotional well-being. Speech and language therapy can improve a child's ability to speak more clearly, help with swallowing disorders, and learn new ways to communicate using sign language or special communication devices such as a computer, a voice synthesizer, or a special board covered with the symbols of everyday objects and activities to which a child can point to indicate his or her wishes. Interventions for problems with eating and drooling are often necessary when children with cerebral palsy have difficulty in eating and drinking because they have little control over the muscles that move their mouth, jaw, and tongue. They are also at risk of breathing food or fluid into their lungs, as well as for malnutrition, recurrent lung infection, and progressive lung disease. Let me mention about the assistive devices which may greatly help some individuals with cerebral palsy. Assistive devices, such devices as computers, computer software, voice synthesizers, and picture books can help some individuals improve communication skills. Other devices around the home or workplace make it easier for people with cerebral palsy to adapt to activities of daily living. Orthotic devices help to compensate for muscle imbalance and increase independent mobility. Braces and splints use external force to correct muscle abnormalities and improve functions such as sitting or walking. Other orthotic devices help stretch muscles or the positioning of a joint. Braces, wedges, special chairs, and other devices can help people sit more comfortably and make it easier to perform daily functions. Wheelchairs, rolling walkers, and powered scooters can help individuals who are not independently mobile. Vision aids include glasses, magnifiers, and large print books and computer typeface. Some individuals with cerebral palsy may need surgery to correct vision problems. Hearing aids and telephone amplifiers may help people hear more clearly. Let me sum up. According to the Rehabilitation Council of India, cerebral palsy is a group of conditions that are characterized by chronic disorders of movement or postures. It is cortical in origin, manifests itself early in life, and is not the outcome of a progressive disease. Cerebral palsy is a syndrome having a combination of characteristics such as motor disorder, medical conditions, sensory impairments, hearing disabilities, attention deficits, language and perceptual deficits, behavioral problems, and mental retardation. Prevalence of cerebral palsy is in the range of 1.5 to 2.5 per thousand live births, While exact figures are unavailable in India, it can be safely estimated that the cumulative figures for living population at any given point of time may be staggering. Most children with a cerebral palsy are diagnosed during the first 2 years of life. But if a child's symptoms are mild, it can be difficult for a doctor to make a reliable assessment before the age of 4 to 5. Cerebral palsy is actually caused by brain damage. The brain damage is caused by brain injury or abnormal development of the brain that occurs while a child's brain is still developing before birth, during birth, or immediately after birth. Cerebral palsy is not a disease, but actually it is a term used to describe a range of conditions that typically cause physical impairment. This type of handicap is a situational barrier or obstacle that limits activity or restricts participation, often temporarily. In many cases, the cause of cerebral palsy is unknown. Possible causes include genetic abnormalities, congenital brain malformation, maternal infection or fever, or fetal injury. Damage to the brain may cause its symptoms. Spastic cerebral palsy is the most common type of the disorder. People have stiff muscles and awkward movements. Conditions of individuals with the cerebral palsy that may require additional support, help, or technology are generally considered to have special needs. The term special needs generally refers to the need to assist, support, adapt, modify, or accommodate a person in order to provide barrier-free, equal access to experiences, events, buildings, information, participation, and inclusion that is afforded to persons without disability or impairment. Some therapies such as physical therapy, occupational therapy, recreation therapy, speech and language therapy, and so on are effective in the interventions with the children with the cerebral palsy. Assistive devices such as computers, computer software, voice synthesizers, and picture books can help some individuals improve communication skill. Other devices around the home or workplace make it easier for people with cerebral palsy to adapt to activities of daily living. Let me sign off now and hope to see you in another session. Thank you.